I'm Dr. Mahmood Adil. I'm National Quality and Efficiency Advisor at the Department of Health. We live in a global village, and we need to understand that whenever there is a problem in one healthcare system, it can have an impact on another healthcare system. For example, we had SARS, which was infectious disease started in Hong Kong, and we end up everywhere. So with that context, it is very important that our medical and clinical workforce need to understand how different healthcare systems work. I have developed International Humanitarian Toolkit, which is basically a guidance developed by Department of Health in 2003. I led that work, and that helped me to understand the issues and try to help the NHS that how best they can send people abroad. I think we can divide into two big things. One is emergencies. So you can see there is earthquake, there is a flood, there is a number of other things, and the WHO, World Health Organization, asked that yes, we need help from other countries, in particular from developed world. And second thing is developmental work. So it doesn't matter which specialty you belong to, you will find a room to contribute both for emergency as well as for developmental work. I got the opportunity in 2007 when there was a Pakistani earthquake. Then we felt that rather than sending a lot of doctors to Pakistan, at that point in time they needed, we did help them. We need to establish a long-term partnership. As a part of that, along with some other colleagues, I led a delegation to Pakistan, and then that was the beginning of my journey to get involved in international health. You need to have a number of skills. Some of them are hardcore skills where you need to be a good surgeon, you're doing hands-on things. There are other things which I put it under softer skills, which is your emotional intelligence. And I think you can learn a lot about softer skills when you are in a very deprived environment. Unfortunately, when doctors or clinicians go abroad, first of all, they don't do their homework well. They are very motivated. I never ever undermine someone's motivation by saying you're just going over there for sake of going. They're very motivated to go to Africa, to Asia, to anywhere they feel there is a need. But if you haven't done the homework well, then chances are that you are not focused. Chances are that you are become ill yourself. And I think this is another thing, that you need to be thinking about your own health. And then not only physical health, but also emotional health. Link with your Royal College. Because almost every Royal College has got some international office or an international link person. He or she would be able to help you linking with the people who had been there. Secondly, go to the DFID website. DFID Department for International Development website is very important because they tell you what is happening on the ground over there. When you go, you need to be thinking how it is going to help me to fulfill my professional competencies. Almost every Royal College training program has got competency framework, and many of the competencies have got something to do with global health. So if you can identify those competencies with help of your trainer, chances are that when you go and work over there in whatever capacity you will come back learning and fulfilling those competencies, and ultimately those competencies would help the NHS, and you would be able to save more lives, you would be able to improve the quality of more lives, and we would be able to deliver more through the NHS because you are more rounded, effective leader as well as healthcare professional.